Now we are going to discuss about what are the physical therapy management of the sciatica. So first of all, the patient education is very important. Then promote self-management techniques such as hot pack and the cold packs for comfort and to decrease inflammation and relieve pain. Avoidance of inciting activities, prolonged sitting, standing, regularly changing position from sitting to standing. Practice good erect posture and use of proper lifting techniques. So what are the exercises? We can recommend the patient for sciatica relief. There are the pelvic tilt, press up, straight leg raise, back flexion, hook lying march, bridging, prone leg, abdominal curl up, buttock stretch, and the piriformis stretch. So we will discuss one by one. First of all is the pelvic stretch, pelvic tilt exercise. The pelvic tilt aids in strengthening the abdominal muscles and is the foundation of many exercises for sciatica pain relief. So performing the exercises correctly is a great starting place to perform the pelvic tilt, like on your back with your knees bent and feet flat on the ground, and pull your belly button in towards your spine. As you are pulling your belly button in, your back will automatically flatten towards the floor and your pelvis will roll up towards your chest. Hold this position for 20 seconds, then relax. Aim to complete 10 repetitions of these exercises. Next is the press up exercise. And the press up extension exercise or press ups are often prescribed to treat sciatica pain from a lumbar herniated disc. Press ups utilize a physical therapy technique called centralization, which helps to move pain up from the leg and isolate it in the lower back, where it originates and can be more easily treated. To perform a basic press ups, lie on your stomach and slowly prop your upper body onto your hands while keeping your hips on the floor. Hold this position for 5 seconds and then lower your upper body back to the ground. Aim to complete 10 repetitions every few hours, gradually working up to 30 seconds per repetitions. If this exercise is painful, start by propping your upper body on your elbows for a gentler extension. Then is the straight leg exercise. The straight leg raise exercise helps to strengthen the abdominal muscles and prevent recurrence of sciatica. To begin the straight leg raise, perform a pelvic tilt by lying on your back with your knees bent up and pulling your belly button in towards your spine. Straight one leg out along the floor and gently raise it 6 to 8 inches off the ground before returning it to the ground. Aim to complete 10 repetitions before repeating with the other leg. Then is the back flexion exercise. Flexion forward bending exercise can help to treat sciatica from spinal stenosis by increasing the size of passageway of the constricted nerve. To perform a back flexion exercise, lie on your back with your legs rested flat on the ground. Gently pull your knees to your chest until you feel a comfortable stretch across your lower back. Hold this stretch for 30 seconds, then slowly lower your legs back to the starting position. Aim to complete 4 to 6 repetitions of this exercise. Then is the hook line march exercise. The hook line march is a dynamic lumbar stabilization exercise. These exercises are often used in physical therapy to help prevent lower back pain by strengthening the muscles that support the spine. To perform the hook line march, begin by performing a pelvic tilt. Lie on your back with your knees bent and press your lower back into the floor by tightening your lower stomach muscles. Slowly alternate raising one foot at a time, an inch or two off the ground. Continue marching this way for 30 seconds. Perform 2 to 3 repetitions, resting for 30 seconds in between the each repetitions. Then is the bridging exercise. Bridging is another dynamic lumbar stabilization exercise that helps to strengthen the muscle that support the spine. To perform the bridging exercise, lie on your back with your feet flat, knees bent, and your arms on the floor besides you. Slowly raise your buttocks 6 to 7 inches off the ground. Hold this bridge position for 8 to 10 seconds. Then slowly lower your buttock back to the starting position. As your strength builds, aim to complete 2 sets of 10 bridges. Then is the prone leg exercise. The prone leg exercise helps to alleviate sciatica by training the body to maintain a comfortable posture for the lumbar spine and the pelvis. To perform the prone leg raise, lie on your stomach with your arms at your side, palm facing the sky. Pull your belly up towards your spine and keeping your legs straight. Slowly alternate raising one leg at a time about an inch or two off the ground. If this exercise is too difficult, you can make it easier by placing your feet underneath the front of your pelvis. Then is the abdominal curl up. Abdominal curl up, one of the most common exercise that may be recommended to strengthen the lower abdominal muscles and alleviate sciatica pain are abdominal curls up. To perform an abdominal curl up, lie on your back, fold your arms across your chest, and perform a pelvic tilt by tightening your lower abs. Lift your head and shoulders from the ground towards the ceiling. Hold this position for 2 to 4 seconds, and then slowly lower your upper body back to the ground. If performing the curl up results in neck pain, place your hands behind your head to support your neck, but be sure not to lift your head with your hands. Aim to complete 2 sets of 10 curls. Then is the buttock stretch. If sciatica is caused by injury or irritation to the piriformis muscles, stretching the piriformis muscles can help to alleviate pain and other symptoms. There are several piriformis muscle stretches that may utilize to treat sciatica. To perform the buttock stretch, begin on all fours. Place your affected foot across and underneath your body so that your knee is facing away from the body. Extend your non-affected leg behind you, making sure to keep your pelvis straight. Keeping the affected leg in place, scoot your hips towards the floor and lean forward onto your forearms until you feel a deep stretch in the hip and the buttock. Hold this stretch for 30 seconds and then slowly return to the starting positions. Aim to complete 3 repetitions of this stretch. Then is the piriformis stretch. Lie on your back with your legs straight, lift your affected leg and bend your knee. With your opposite hand, reach across your body and then gently pull your knee towards your opposite shoulder. Hold this stretch for 15 to 30 seconds. Repeat with your lower leg. This one. For this piriformis stretch, lie on your back with both feet flat on the floor and both knees bent. Rest your left ankle over your right knee. Pull your right thigh towards your chest. Hold this stretch and repeat for each side. So these are all the exercises for the sciatica. Thank you.